Today we're going to be teaching you standing proprioception. Proprioception is a body sense that essentially allows me to do this. Our brains and our muscles are in constant communication with each other, and when you have a painful syndrome or an injury to an area, it can disrupt that normal flow of information. Now we're most concerned about the proprioception around the lower leg and ankle, because if this is not properly developed, it leads to patients stumbling into things or falling down and re-injuring themselves. So this is an important sense to retrain or even to freshen up on. So this is a very simple exercise, but it's a graduated one. So we're going to test you through very easy versions of the exercise to more advanced versions of the exercise. So your overall sense of balance is actually determined by three body senses: proprioception, which I mentioned, sight, and the inner ear apparatus. So the way that we're going to increase the challenge is by starting with all three senses intact and then taking one or both of those other senses away. So the exercise is very simple. You just want to stand on one leg. Now with this other leg, you don't want it touching the ground or hanging out on the other leg. Both are cheating. Okay, so first version of the exercise is very simple. Keep your head nice and straight on horizon and just lift one leg up and stand here. Now the goal is to get to where you can do this exercise for about a minute without much wobbling or having to set your foot down. Okay, I'm going to teach you the other versions of the exercise. So the next thing we want to do is take the inner ear out of the equation. So what you do is you come over, shift your weight to this leg, and then tilt your head all the way back. This puts the inner ear apparatus at a place where it can help out with balance. Okay, and next version of the exercise is come to this position first, and then close your eyes. Okay, and then the final version of the exercise is you're going to take the inner ear and the eyes out of the equation. So I want you to come up here first, then tilt your head back, and then close your eyes. Okay, the CA is now going to assess which step is most appropriate for you. You don't want to move on to the next step until you can do the previous one for a minute fairly easily without a lot of wobbling.